Namaskar to all. Welcome to Saffron Educational and Medical Foundation, an opportunity to be your own doctor today.
Namaskar. I'm Dr. Mona, naturotherapist and diet consultant since last 17 years in Mumbai. Every time, whenever we share any topic about any knowledge, make sure this is completely with the scientific reason, with a specific research, as according to our experience since last 17 years of experience. So we always talk with the facts and analysis. So this is completely a scientific channel and we always provide you the best knowledge. So there is nothing like just reading and just giving you the knowledge. No, it's with the experience. So every time we share certain topics, certain disease, and with that we try to give you the proper solution. That is also the naturopathy point of view. So let's start today's lecture. Today we are going to talk about a very common, well-known problem, that is sciatica. Sciatica, that is a nerve, sciatic nerve. Basically, you may heard like patients are always complaining like they have a pain throughout the leg starting from the back to the lower leg. So that is whenever you're going to check, so the diagnostic comes as it's a sciatica pain. Of course, it is very common throughout the world, but specifically, this is very common for those who have the standing work position, like a sales girl or the other, those who have long standing hours for their job point of view. So, they are very much prone to face the sciatic problem. Sciatica basically, if you see what is sciatica, so the most common problem of sciatica, that is when you see continuous pain with inflammation, that is called the sciatica pain. And specifically if you observe, it is always in a single leg. 90% of the cases sciatica pain occurs in single leg only. It will never in two, both or both the legs. This is one of the common feature that you can bifurcate to know about the sciatica pain. So basically sciatica refers to back pain caused by a problem with the sciatica nerve. See, we have so many nerves throughout the body. Sciatica nerve is the longest nerve in our body. It is one of the longest nerve that runs from lower back to down the back of each leg. See, it starts from the lower back to the lower back and up to and to the legs. When something injures or put pressure on sciatica nerve, it can cause pain in lower back, which spreads through hip, buttocks and legs. As I just told you, like this pain is a radiating pain. It is not only limited up to the back pain only. When it aggravates, when it starts, so it spreads through each and every part of till the end of the leg. So it starts from the back, it reaches to the buttocks, legs and end of the legs. So it's a continuous long pain. Because of that, patients get irritated. Continuous pain not allowed them to make their daily routine work. They even can't stand for a longer period of time. They even can't walk. Because of the inflammation, there's a pain. Because of the pain, they get irritated, not comfortable, not able to do their routine walks also. Here there is a myth like mostly the females are very much prone to face. No, it's completely not true. Actually, if you see the observations according to the American research, there is diagnosed or they have the research like the specifically the males, those who have an habit to put their wallets on the back side of the pocket, they are actually very much prone to face the sciatica pain. Because what happened, that back side of wallet, on the back pocket of the wallet pant, because of that the wallet which is full of monies and credit cards and so many things, it puts the pressure on your sciatic nerve. And when the sciatic nerve gets pressure, the pain aggravated, the effects on the circulation system, it get inflamed and starts the sciatica pain. So it is also true, like every time if you feel the back pain or the lower back pain, it is not always the sciatica pain, but of course once in a lifetime each and every one of us may face the pain. So you can say 85% of the world's population may feel the pain throughout once in a life, but it is not always the sciatica pain. Around, if you observe, and in my OPD also I had observed, like mostly you can say 90% of the sciatica pain occurs only in single leg. It will never in both the legs. It is very rare. So this is one of the common symptoms to diagnose the sciatica pain. Okay. So let's see the what are the symptoms which you can come to know like this is the sciatica pain. The most common symptom is pain. Yes, pain which starts from lower back to buttocks to the lower legs. It can lose then, see, this pain can get worse when you sit for a longer time, when you cough or when you sneeze, because that time you know what happened, your body gets little bit of jerk, and during that jerk period that pain, that nerve get more pressurized, it's stretched, and because of that the pain is aggravated. So those already who suffers from the sciatica pain in this specific position of sitting, sneezing or coughing, the pain get aggravated or they have the pinching pain during that period. So leg way also feels numb, weak, tingling at a time. This is another symptom of sciatica pain. See, all these things occurs stage by stage. Initially, the first thing that you feel is pain, inflammation. Once they get aggravated, gradually the numbness occurs, the weakness occurs. After having a proper food, proper rest, and with the full nutrition, still you feel little weak. Your legs feel weak, numb. Sometimes the tingling sensations are there suddenly. So these are another symptoms of sciatica. Usually it appears suddenly. See, there is no specific time, but still, as an observation and as per the research, we used to say, first of all, this pain occurs suddenly without giving any intimations, or it is not a gradual also. Suddenly the pain occurs. And the duration of this pain may vary from a day to a week. It depends on your physical health. Like if you are on another medications, if you are overweight or obese, about your age, then your appetite level or the digestion, all these things taken in account when you are suffering from the pain. According to the age bar, the physical structure and your digestion, pain may varies, symptom may varies. But this is the common symptoms. Let me clear: pain, numbness, weakness in leg, tingling sensation, and specifically when you have certain type of jerks, the pain get aggravated, right? So this is what happened in sciatica.